सभी को मेरा नमस्कार। विश्व आयुर्वेद परिषद की ओर से आयोजित इस अनवरत व्याख्यान माला में मैं आप सभी का हार्दिक स्वागत करती हूं और आज हम 27 सितंबर को आप सभी के सामने उपस्थित है। आज के स्पीकर का एक धन्यवाद तो सामान्य रूप से हम सभी का करते हैं, वो बनता ही है, और आज एक एक्स्ट्रा धन्यवाद भी सभी की ओर से और ये विश्व आयुर्वेद परिषद के इस मंच की ओर से मैं करना चाहूंगी कि डॉक्टर शिंशा वर्तमान समय में मेडिकल ऑफिसर है नेशनल इंस्टीट्यूट ऑफ आयुर्वेदा पंचकुला हरियाणा में। और आपका एक अग्रिम धन्यवाद और स्पेशल वाला बड़ा धन्यवाद, क्योंकि आज इमरजेंसी हो गई थी और मैंने अभी 3 दिन पहले ही डॉक्टर शिंशा को पूछा कि ऐसे ऐसे किसी और स्पीकर का समय था मगर वो किसी कारणवश नहीं दे पा रहे हैं, तो क्या आप कर लेंगे, और आपने तुरंत ही अपनी सहमति दी। तो इसलिए एक अग्रिम धन्यवाद लेते हुए मैं धन्यवाद देते हुए आपका मैं फिर से ये आज के व्याख्यान की शुरुआत करना चाहूंगी। आपका आज का टॉपिक है मैनेजमेंट ऑफ द कॉमन स्पाइनल डिसऑर्डर्स इन आयुर्वेदा। और आज के स्पीकर के साथ हमारा परिचय करवाने के लिए डॉक्टर दिव्या, गायनी में पीएचडी स्कॉलर फ्रॉम केरला। आपका भी तहे दिल से बहुत बहुत धन्यवाद, क्योंकि इससे पूर्व मैं लगभग 4-5 स्पीकर को पूछ चुकी थी मगर सभी व्यस्त थे, और आपने डॉक्टर शिंशा का नाम बताया तो मुझे फिर भी संशय था कि भगवान करे हाँ बोल दे, तो ऐसा ही हुआ। तो डॉक्टर दिव्या, आपका भी तहे दिल से बहुत बहुत धन्यवाद। जैसे हमारी परंपरा रही है कि हम सबसे पहले अपने स्पीकर का परिचय आप सभी के सामने रखते हैं और फिर हम आज के व्याख्यान की शुरुआत करेंगे। जैसे मैंने आपको बताया, डॉक्टर शिंशा की बीएमएस केरला मल्लापुरम से वीपीएसवी एवीसी कोट्टकल से आपने पूरी की है। एमडी काई चिकित्सा में फ्रॉम द ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा सरिता विहार न्यू दिल्ली अय्या से आपने पूरा किया है। वर्तमान समय में आप पीएचडी परस्यू भी कर रहे हैं। आप डिपार्टमेंट ऑफ काई चिकित्सा नेशनल इंस्टीट्यूट ऑफ आयुर्वेदा डीम्ड टू बी यूनिवर्सिटी जयपुर राजस्थान से अभी आप पीएचडी स्कॉलर भी है। इसके सिवाय मैं देख रही थी कि आपको समय समय पर बहुत सारे बेस्ट पेपर अवार्ड्स, चरक अवार्ड्स, जो गुजरात बोर्ड ऑफ आयुर्वेदी एंड यूनानी सिस्टम मेडिसिन से नवंबर 2021 में contribution as an author of the book Arbuda, an Ayurvedic research-based documentation on the lung and cervical cancer, published by the ऑल इंडिया इंस्टीट्यूट ऑफ आयुर्वेदा ऑन फरवरी 2020 में आपने प्राप्त किया है। इसके सिवाय आपको बेस्ट पेपर अवार्ड अलग अलग जगह पे, जहां भी मुझे लगता है कि लगभग आपने पार्टिसिपेट किया, वहां सभी जगह आपको बहुत सारी जगह बेस्ट पेपर और बेस्ट प्रेजेंटर अवार्ड मिला है। और आपने वर्किंग एक्सपीरियंस में आपका असिस्टेंट प्रोफेसर काय चिकित्सा में, इससे पूर्व आप मुजफ्फरनगर यूपी भगवंत भगवंत आयुर्वेदिक कॉलेज में आपने काम किया है, और उसके बाद अगेन असिस्टेंट प्रोफेसर के पद के ऊपर आपने गुजरात में पारुल इंस्टीट्यूट ऑफ आयुर्वेदा एंड रिसर्च वडोदरा गुजरात में भी आपने काम किया हुआ है, और इसके बाद अभी मेडिकल ऑफिसर में पंचकुला में अभी आप वर्तमान समय में कार्यरत हो। आपकी बुक्स में और चैप्टर्स के कंट्रीब्यूशन में भी आपने आईएसबीएन नंबर के साथ एक पुस्तक है, उसमें चैप्टर नंबर 14 इंटाइटल थेरापेटिक न्यूट्रिशन इन आयुर्वेदा फॉर द न्यूरोलॉजिकल डिसऑर्डर इन द बुक टाइटल एंड थेरापेटिक न्यूट्रिशन इन आयुर्वेदा, इस वाले में इस नाम का आपने चैप्टर लिखा है, जिसके लिए। और एक दूसरा वी जी हुदार, इसमें अर्बुद आयुर्वेदिक रिसर्च बेस्ड डॉक्यूमेंटेशन एनालिसिस लंग एंड सर्वाइकल कैंसर के ऊपर भी आपका उसमें कंट्रीब्यूशन है। और पब्लिकेशन में आपने बहुत सारी जगह पे पीयर रिव्यूड जर्नल्स में, नेशनल और इंटरनेशनल जर्नल्स में बहुत सारा आपका योगदान है। एज अ पेपर प्रेजेंटर, एज अ पोस्टर प्रेजेंटेशन एंड एज अ रिसोर्स पर्सन भी आपके बहुत सारे मोर देन 7 जगह पे आपने पार्टिसिपेट किया और प्रेजेंटेशन किया है, और बहुत सारे सेमिनार्स में जहां आपने किया है वो तो बहुत बड़ी संख्या है। अभी आपकी उम्र ही छोटी सी है, मगर आपकी उसमें प्रेजेंटेशन की संख्या मैं देख रही थी कि 44 है। जो आपने अलग अलग जगह पर किया है। तो मैं इन ब्रीफ आपका बायोडाटा सभी के सामने रखा है, और जो मुझे इसमें सबसे लग रहा था कि आपने क्विज कंपटीशन में, एक्स्ट्रा करिकुलर में, ऐसे कंपटीशन में, श्लोक कंपटीशन में, है ना, या में जहां आपका अष्टांग हृदय पे हुआ था, वहां भी आपने फर्स्ट प्राइज आपने प्राप्त किया है, क्विज में सेकंड किया है, ऐसे में थर्ड प्राइज किया है। यानी लगभग आपने जहां जहां भी, चाहे कल्चरल एक्टिविटीज हो, चाहे एजुकेशनल एक्स्ट्रा करिकुलर एक्टिविटीज हो, सभी में आपका हमेशा बहुत बढ़िया योगदान रहा। ऐसे विद्वान स्पीकर को मैं आप सभी के सामने यहाँ आमंत्रित करते हुए इस मंच पर बहुत ही हर्षित हूँ, गौरवान्वित हूँ, और अग्रिम धन्यवाद, स्पेशल धन्यवाद फिर से देते हुए आज के व्याख्यान
हुए आज के
हूँ। डॉक्टर सिंशा, ओवर टू यू।
Thank you so much, ma'am, for this beautiful introduction. Namaskaram.
बहुत बहुत वेलकम
And
बेटा।
I would like to thank you, ma'am, for this, for giving this opportunity for me.
नहीं नहीं,
Being a
आपने तो
beginner
बहुत
with
अच्छा बचा लिया
issues me. Thank you, ma'am. Thank you. Anyway, thanks a lot for this opportunity to Professor Haidal Dave, madam, and Vishwa Ayurveda Parishad. Very good evening to all. Today, myself, Dr. Shinsha, I'm presenting this topic, management of common spinal disorders in Ayurveda. So, थोड़ी बहुत theory तो बोलना ही पड़ेगा, but उसके बाद I would like to share some of my experience, and I would like to invite you all for this interactive session also. You can share your experience also. Okay, let us start now. There are some network issues, so that I'm turning off my video. So hope the slides are visible.
हाँ, विजिबल, यस डॉक्टर साहब जी।
Thank you, ma'am. Let's start. Ma'am, just a second. It is just,
जी जी, कोई बात नहीं।
I think it is stuck.
जी, कोई बात नहीं।
Okay. Let me start the slideshow again.
हाँ जी हाँ जी, कोई दिक्कत नहीं। सभी पार्टिसिपेंट्स, आप सभी को बस मैं 1 मिनट में, जब तक डॉक्टर साहब वापस आते हैं, फिर से आपके सामने एक विचार रखना चाहूंगी। जैसे आप सबको
जैसे आप सबको भी
कि मैं बहुत बार
कि
आपको
मैं बहुत बार आपको
डॉक्टर सिंशा, आप
डॉक्टर
माइक
शिक्षा
म्यूट कर देंगे एक बार?
yes
जी, इको आ रही है।
just go on.
जी।
जी जी
जैसे मैंने आप सभी के सामने बहुत बार रजस्वलाचर्या का पॉइंट रखा है, हो सकता है आज भी कुछ अलग पार्टिसिपेंट्स हो, तो ऐसे किसी और को भी इस बात का, विषय का पता चल जाएगा। तो मैं फिर से एक बार आप सभी के सामने दोहराना चाहूंगी कि आप अपनी अपनी प्रैक्टिस में रजस्वलाचर्या को जरूर स्थान दीजिए। अगर आपकी पेशेंट, है ना, 12 साल से 50 साल, यानी 45, 47 या 48, जब तक मेंस्ट्रुएशन ऑन रहती है तब तक में होती है ना, सिंपल सी एक लाइन का मैसेज है कि ड्यूरिंग द मेंस्ट्रुअल फ्लो डेज में, है ना, उन दिनों में लाल चावल घी के साथ और जौ के दलिए की खीर खानी है ना। तो बहुत ही, जो भी डिसीज में, जो भी कोई भी रोग के लिए वो आपके पास कंसल्ट करती है, तो इन बिटवीन द ट्रीटमेंट टाइम और आफ्टर ट्रीटमेंट टाइम ऑल्सो, तो रिकरेंस से भी बचेंगे और इसमें भी मुख्य रोग को ठीक होने में मदद मिल जाएगी। डॉक्टर सिंचा, ओके? हेलो, slide is visible. Now spinal disorder slide
okay okay
visible. जी जी, ओके
okay ma'am.
ओके।
Is that okay?
हाँ
My
जी हाँ
voice
जी,
is audible?
हाँ, वॉइस इज ऑडिबल एंड स्लाइड स्पाइनल डिसऑर्डर, ओके।
Okay ma'am, thank you ma'am.
जी जी।
So let us start now. So we all are sitting in OPD and seeing many cases regarding spinal disorders. We know that at least 2 or 3 patients complaining of backache is a common scenario in our OPD, and we have to analyze the case, we have to diagnose the case, and accordingly we have to treat the case. First of all, remember one thing: all back pain doesn't have a single line of treatment. We have to think about the case. What is the nidana? What is the samprapti? What is the probable doshas involved? What is the major any systemic illness is associated with? There are many questions arising when you see the patient. So after doing proper examination, proper history taking, we can get a diagnosis and start the treatment. So this is an important point: low backache and neck pain. Because of the time limit, I'm focused on low back pain in this today's presentation. And even though I will tell the some common etiopathogenesis of all the spinal disorders. So spinal disorders can be structural or functional abnormality. Major common causes include, maybe it is related to age-related degenerative disorders. It may be due to any injury, which causes any vertebral fracture or any ligament injury, any muscle injury, or any other chronic conditions, including ankylosing spondylitis, rheumatoid arthritis, or osteoarthritis, may be the cause of the spinal disorders. And sometimes it is due to lack of activities, sedentary sitting, sitting for a long time. Especially we are seeing nowadays, many patients are complaining of low backache due to excessive sitting, and there is no gap for them to stretching or walking like that. No time for us physical activities. It may also causes low backache. And even neck pain also, it is caused by many lifestyle factors like improper posture, use of computers, like that. And based on the area affected, we can classify the spinal disorders as cervical, thoracic, or lumbar disorders. So why you are more cautious about low back pain? Because it is highly prevalent in these days, and this is the main cause of years of lived with disability. जैसे कोई अगर ऑफिस में छुट्टी ले रहे हैं, उसका एक कारण में सबसे मेजर कारण ये है लो बैक एक. रेगुलर रूटीन में कोई जैसे 40 से लेके 64 65 तक कोई भी डेली लाइफ में कोई बर्डन है उनको, या कुछ काम करने में दिक्कत है, या उनका रूटीन वर्क करने में दिक्कत आ रहे हैं, उससे सबसे बड़े कॉज ये है लो बैक पेन. इवन नेक पेन, LBP means low back pain, is the first leading cause of disability. This is chronic and it affects the quality of life, economic, it also causes economic burden also. And even neck pain also, it is the fourth highest in terms of disability as measured by YLDs. YLD means years lived with disabilities, and 21st in terms of overall disease burden. It is the 21st. As a study published by Lancet Rheumatology, this values are given. And low backache and neck pain have greater impact on your work capacity and healthcare costs than any other musculoskeletal condition. 70 to 85% of the population will experience back or neck pain at some time in their life. This is a huge value, I think. And even we all are experience back pain at least once or twice in our life. And for some people, it is persisting, recurrent, and chronic, and affecting our quality of life also. Between 14% and 15% of adults have LBP at some time during any single year. It is regarding the single year, and the above is regarding the overall lifetime. Then prevalence of low back pain and neck pain, I already told. Nowadays, 619 million people worldwide suffered from low backache. It is the value of 2020, and it is predicted value in 2050 is 843 million. Means it will increase nearly twice, or 60% increase is predicting. And even neck pain also not so small. Then gender wise, we all know that females are suffering more, but not that much difference from men also. After 35 years, 35 to 45 years is the peak time for low backache. And even after 60 years also, there is peaking of low backache. But after 60 years, it is almost due to the degenerative causes. And around 50 years in the low backache peak in men. So neck pain also more common in females, peaking between 45 to 74 years. Then let me add some revision about anatomy of the vertebral column. I know you all people are know about this anatomy, even though just have a glimpse about this anatomy of vertebral column. Here we have two parts, mainly a vertebral body and a vertebral arch. Vertebral body forms the anterior part of the vertebrae and is the main weight bearing component. And this vertebral body also contains superior and inferior hyaline cartilage. Vertebral body is lined with the hyaline cartilage over the superior and inferior aspects, and adjacent vertebral bodies are separated by fibrocartilages in the vertebral disc. And in the vertebral disc is the major area of which is affected and cause many diseases. So just see the anatomy of intervertebral disc. We can see you can see here it is the middle portion is the nucleus pulposus, and it is covered by a thick membrane known as annular fibrosis, which is circular layers, which is known as lamella. Then annulus fibrosis is a outer layer and made up of tough fibrous cartilage and consists of a series of concentric rings called lamellae that surround the nucleus pulposus. Nucleus pulposus is the inner jelly-like substance, and it is mostly composed of water, proteoglycans, and collagens, and which helps to give its elastic properties of the intervertebral disc. The nucleus pulposus is also rich in nutrients and which helps to nourish the surrounding tissues also. Then comes to vertebral arch. It forms the lateral and posterior aspect of each vertebrae. We can palpate this vertebral arch also. In combination with vertebral body, vertebral arch forms the enclosed hole, that is the vertebral foramen you can see here. The foramina of all the vertebrae line up to form the vertebral canal. Through this, our spinal cord is moving down, and the vertebral arches have several bony prominence, and it is act as an attachment of sites for various muscles and ligaments, which includes spinous process. You can see the spinous process. This is the area we can palpate, and lamina, it is the which connecting this articular processes and the spinous process. Then here it is the superior articular process. Below, similarly, we have inferior articular process also. Then this is the pedicles which connects arch with the vertebral body, and these are the transverse process. So let us come to classification of disorders now. So there are various types of spinal disorders we are encountered in OPD, like radiculopathies are there, spondylosis are there, intervertebral disc diseases are spinal canal stenosis, degenerative disc diseases of spine. Then some spinal diseases may be due to systemic illness like infections like TB, inflammatory like ankylosing spondylitis, then some kind of neoplasms like leukemia, then metabolic diseases also can cause spinal disorders. And there are some non-specific spinal pain and referred pain also, can be present as the low backache. I think the slide changing is a little bit delay. Then next, these are some classification of the disease. We can see here spinal pain with serious systemic illness, and it include at only 1%. And here we can see non-specific spinal pain. It is nearly 90% of the total spinal pain. And here this is a red flag sign, because not all the back pains are not derived from spine or vertebrae. We have to consider other organs, which visceral areas also, and have to rule out the other causes like infection in neoplasm, aortic aneurysm, or visceral causes like kidney or ureteris and stomach factors. Like that, we have to rule out every time. Proper history taking will help you to rule out this. Next we can go for assessment of back pain. So assessment of backache is very important, and सबसे पहले आपका history ठीक से लेना है. और history taking is an art. Don't ignore any point. आपको जो patient बोल रहे हैं सारा points चाहिए, और आपको जो भी आप जानना चाहते हैं वो आपको बीच बीच में पूछना है. Don't interrupt the patient's flow. And the patient states that he developed sudden backache, which was followed a few days later by severe pain in the left calf. Then 2 days later, he noticed numbness of the outer two toes and difficulty standing on tiptoe. By that time, the backache had ceased. And if a patient is state history like this, then we got the clue that this is the story of an S1 root compression with neurological deficit. And maybe, and most probably, it is caused by a large disc protrusion at the level of L5S1. That is the importance of history. History should be, you should have to arrange the history in a chronological order, and the progression of the symptoms you should note. And what is the associated features like numbness, paresthesia, tingling, pins and needles. If there is, then you have to understand that there is a neurological deficit also, and then come to the diagnosis or conclusion. After the history has been taken, the examiner should have a fair idea of the diagnosis, or at least be able to distinguish activity related backache from non-activity related, referred or functional pain, like that. So we have to arrive at a conclusion. If it is not a final diagnosis, we should have an idea about what should may have. So that is the contribution of history for your diagnosis. So here also you have to ask about the localization of symptoms. So localization of symptoms. We all heard about lumbago, backache, sciatica. Many terms are there. So what is the difference between these terms? Actually, lumbago is a sudden attack of severe low back pain, causing some degree of fixation and twinges on attempted movement. Then backache, any discomfort in the lower back or gluteal, including gluteal region, can be termed as backache. Sciatica is the pain that radiates strictly from the buttock to the posterior thigh. That means through the specific dermatome. In the distribution area of the sciatic nerve, only include termed as sciatica. Maybe it may be accompanied by paresthesia and motor or sensory deficit also, but the area affected should be specific to the area supplied by the L4, L5 or S1, S2 nerve root. So that is the difference between lumbago, backache and sciatica. And the symptoms are all the symptoms are grouped under these headings: lumbago, backache and sciatica. In lumbar spine problems, mechanism of causation is usually reflected in the behavior of the pain. Okay, then localization of the symptoms, their evolution and the relation to activity and posture differ according to the tissues involved. This you have to note. Then assessment of बैकएक में आपको एज एंड डेली एक्टिविटीज भी पूछना चाहिए क्योंकि किस कारण से ये हो सकता है. तो ये here we can see that table most common disorders in particular age group. Likewise, in 15 years of age, that spondylolisthesis is the most common. Vertebrae is sliding over one another. That is spondylolisthesis. Ankylosing spondylitis is the second and third decades. It is more common. Ankylosing spondylitis. Or in that age group, we can see most of the most common cause is the inflammatory backache. Then 20 to 50, these lesions may cause, and elderly spinal and lateral recess stenosis is the most commonest cause of the backache. This lesion causing backache and sciatica are most common between 20 and 50 years. Then under the age of 20, discodural interactions are very rare, although almost not possible also. And sciatica, if there is some means major history of trauma or stretch or strain, then it may be possible. Otherwise, it is very rare below 20 years. When sciatica caused by a posterolateral disc protrusion can be expected from adolescence to old age also. Elderly patients may have stenosis, and also degenerative spinal stenosis is a disease that occurs more commonly in elderly patients. Then postural ligamentous pain. Postural ligamentous means which is related to posture of a person, means those who are sitting or standing for a long time, then they may have postural ligamentous pain, and this is more common in young patients with a standing or continuous sitting job. Ankylosing spondylitis typically provokes alternating sciatica. Maybe it is alternating in the sense sometimes it may be in the left side, then it comes to right side, like that. The symptoms will vary between left and right side. That is alternating sciatica. Then regarding the symptoms, you have to assess what is the site of pain, severity, duration, whether it is unilateral, bilateral, like that. Then if there is associated feature of paresthesia, numbness, like that. Then influence of posture or movements of coughing or sneezing is there or not. Then sequence of backache and root pain, means which came first. Usually backache came first, then root pain comes in after that. When routine starts, almost backache subsided. Bowel or bladder problems are there. If it is then Cauda equina syndrome may be the chance. That is an emergency conditions. So we have to refer the patient. So these things you have to note every time. Then regarding unilateral, it is unilateral pain is most common in discodural lesions. Discodural means causing nerve root compression or nerve compression. Then bilateral bilateral pain is common in spondylolisthesis, and many cases neoplasm is also the cause of bilateral pain. Then backache coming on over some hours or even the morning after doing heavy work involving much stooping and lifting, which suggests a soft disc lesion. That is activity, how it relates with activity. Means it will in morning it is okay, then after doing some work, then it start like especially lifting an object, then it suggests soft disc lesion, and it may increase the size and cause the more discomforts or neurological deficits in later. Acute lumbago which starts suddenly at the moment of patient bent forwards or lifted a weight. Then it is a typical of a hard annular disc displacement also there. There may be annular tear also there. So these are some clues we are getting from the history of the patient. In most discoradicular interactions, pain typically starts in the back and sooner or later shifts into one leg. Okay. Then shifting pain is of this nature strongly indicates a disc lesion. Backache, which starts from the back, then later shift into one leg. That is due to mostly due to a disc lesion. If backache gradually increases and after some time extends into one leg and finally involves the back and both legs, it suggests a progressive lesion such as tumor. So I'm saying this all because we have to take the uh, history very cautiously. Pain starting in one leg, slowly getting worse over a period of months, then finally spreading upwards or posterior aspect of the thigh is very suggestive of a primary posterolateral protrusion, which compressing the S1 root. And the lesion occurs in young adults also. And chronic sciatic pain in elderly, which is extending over months to years, and is a typical radicular pain from a narrowed lateral recess. So, while seeing the patient, while saying this, hearing the symptoms and associate symptoms, then we may get the consider the patient also, age of the patient, occupation of the patient. We will get the clues without any investigations. We can come into a conclusion or diagnosis. Then in ankylosing spondylitis, the pain will sometimes it is alternating pain also there, and bilateral sacroiliatic arthritis is there, and early morning stiffness and pain is common, which is eases by activities, such as after doing some walk or doing some work, then pain comes reduced. That is a common feature in ankylosing spondylitis. Even in many of the inflammatory diseases also present like that. So there are many things regarding this history. I just want to skip this. So always ask the patient about the relieving factor and aggravating posture. Relieving posture and aggravating posture. If the patient is having normal without any symptom, but while he's walking a few distance or a prolonged standing will trigger the pain. It's like a neurogenic claudicatory pain. The term is used here is neurogenic claudicatory pain. It is most common in case of the canal stenosis. Okay, spinal canal stenosis or any lateral recess stenosis also cause this same symptom. The patient will present like this only. The patient is having severe pain. Saddle anesthesia means there is numbness over the buttock region. Then having bowel bladder incontinence or urgency or constipation also can be a Kodak syndrome. Okay, there we have to refer the patient soon. Otherwise, permanent damage will result. So even we know patient's reaction to these symptoms is also important because many times psychogenic low backache, even neck pain is also the patient may have this kind of
Okay, ma'am.
presentation. Yes, ma'am.
सॉरी बेटा, ये असेसमेंट ऑफ द बैक पेन वाला जो है ना, ABCD सिम्टम्स, वो वाली स्लाइड प्रेजेंट हो रही है।
हाँ मैम, इसी में नेक्स्ट नहीं हुआ।
बैक पेन असेसमेंट है, जिसमें फर्स्ट वन है हिस्ट्री इन क्रोनोलॉजिकल ऑर्डर, लोकलाइजेशन ऑफ सिम्टम्स।
लास्ट डी पॉइंट दिख रहे हैं मैम, लास्ट डी पेशेंट्स रिएक्शन टू दिस सिम्टम्स।
जी जी जी, पेशेंट्स रिएक्शन
हाँ,
टू दिस सिम्टम्स, या
यस मैम,
वही
नया
डिस्प्ले
स्लाइड
होनी
है मैम।
चाहिए ना।
हाँ, यस मैम,
ओके
सही है।
ओके, ठीक ठीक ठीक, ओके।
So we must have take care of the patient's reaction to these symptoms. Sometimes patients will complain very in a miserable manner. The patient says, "I can't live with this back pain." Like that, the patient exaggerate the symptoms, but while turning around, the patient is almost normal. So always keep an eye on the facial expression of the patient because there may be it is malingering of the patient, it may be otherwise hysteric ho sakta hai, otherwise the patient have other problems and is presenting as his, other psychiatric problems but is presenting as the somatic problem, that is back pain or neck pain also. Even this study published in Lancet, I saw yesterday, I saw that study, and it claimed that 90% of the neck pain especially in females, is due to stress, anxiety, and stress. So there we have to take care of this factor. It is very important to know the cause of back pain or neck pain, anything. Then here we have some activity related spinal disorders, which includes discodural. And here, what is activity related means it is obvious that the relationship between the symptoms and posture or exertion should be there in the presenting symptom. That is, maybe it may be due to bulging disc, herniated disc, degenerative or thinning of the disc, whatever may be, there's activity related exacerbations or remissions will be seen in the patients. And many times, if some patients ligamentous pain, if having ligamentous pain, typically occurs in relatively young people and is created by prolonged or increased postural stress. And if the patient is having some change in his posture, the pain will relieve. If it continues to stay in that posture, then it will increase. So that is that is due to ligament. Okay. Then exercise will a good remedy for this kind of back pain, and even our Abhyanga Svetana is also a very good remedy in such kind of back pain. So while taking the history, even we can plan the treatment. That's why I'm stressing again and again in the history taking. Then regarding this non-activity related spinal disorders is mainly due to inflammation and osseous disorders. Acquired defects may be हो सकता है, and tumors and metabolic disorders are the main cause of non-activity related disorders. यहाँ पे आपको activity related ज्यादा नहीं मिलेगा. More than that, there are some other exacerbation factors like maybe diet हो सकता है, otherwise fever हो सकता है, otherwise temperature, climatic changes हो सकता है. For example, ankylosing spondylitis may increase pain during cold seasons. It's like that. Then ankylosing spondylitis, I just want to say something about that. It is a more common presentation. And many of the time, in the initial stage of the ankylosing spondylitis will be present as Amvata. There we can see the clear association of ama. But the symptoms will vary in unexpected way also. Sometimes we are expecting something, we are not get upashya with that. Patient is having severe ama condition, but Rukshana will increase the pain. So this is a common problem we are experiencing in treatment because of the predominance of Vata. Even Vaidranavasti is also increase the pain. It may be, that's why I'm saying this a Vishama or Avastha of Vayu is here. We have to assess the Nitana. If it is Vata dominant, then go for Vata Kapha Shamana, which is along with the Dipana Pachana medicines, that is the better thing. Even Tikta drugs we can use more here. But excessive Rushna will not be done. Before that, we can use Churna Pinda Sveta, Lepa, instead of Valuka Sveta. We can use this Svetana types. Even Abhyanga also we can try with the, some Tailas, which including like Chinjari Taila, Murivenna, and like Amla Dravya Satita, Panjamla Taila. This will not cause any inflammation, means will not increase the sofa. In that condition, we can use this kind of Taila also, Taila preparations. So should we take care of ama? Then many of the patients, one day the patient awakes without any discomfort. Then the next week the patient may have with the severe painful back as a common presentation in ankylosing or even other seronegative and sacroiliitis condition also present like that. In rheumatoid conditions, pain is typically experienced most severely in the morning and improves throughout the day. In malignant disease, here you have to take care. The pain is unremitting. That is and worse at night. It's a common thing we can see. If the patient is having chronic back pain or acute severe back pain, also you have to take care, and which is not responding to other measures, even not with analgesics, then there may be a chance for malignancy, and should go for an MRI in that condition. Lumbar pain increases steadily even after root pain has set in this condition. That means that may be due to malignancy or any tumor cause like this. So next thing is pain referred to back. This is also very important. We have many visceral organs. This may also cause intra-abdominal or pelvic lesions. Then aneurysm of aorta, genitourinary causes like PID, then prostatitis. This all may cause low backache, even in some patients with large uterine fibroids also complaining of regular intermittent back pain, along with the other presentations like menstrual dysfunctions, bleeding. And in such cases, one case I remember just telling that is the patient is having uterine fibroid, but the size is increasing gradually, and the patient experienced some burning maturation and UTI-like features and constipation also. In that case, the patient, and in that time also, the patient is complaining of low backache. We are treating that patient with medicines for backache like tasnaseptic like that, but we haven't go for USG. After 1 month, suspecting some other features, then go for a USG. Then we find that there is a large uterine fibroid, but it should have to do some surgical intervention. Hysterectomy goes done. Then back pain also subside after that. Just sharing one of my experience regarding referred back pain. So always care cautious about this warning signs like pain in the upper lumbar region suggests possibility of aortic aneurysm, neoplasms, ankylosing spondylitis, or may result from other visceral diseases. And steadily increasing lumbar pain, especially in elderly patients, may be a malignant cause. And gradually expanding and increasing pain is associated with a lesion that is increasing in size, that is neoplasm or neuroma. And continuous pain, which is not altered by movement and posture, is omnious, and it is important to remember, however, that endless pain may also be present in psychogenic disorders. This is also very important because we are always look for upashaya, anupashaya in kind of ahara, vihara, aushada. If you are not getting any percentage of relief, even you don't have any percentage of aggravation also, that may be due to a psychogenic factor. So thus you should have to take care. So one of the emergency condition I told already, that is Coda Equinox syndrome. The common causes herniated disc in lumbar area may be due to spinal canal stenosis, and spinal tumor also may be the cause, and spinal infections, hemorrhage, trauma. This all cause Coda Equinox syndrome, and it's an acute medical condition that requires urgent referral to neurosurgery, because if you prolong the surgery, then there may be chance of permanent damage. So we think it is best if the surgery is done within a 14 hours of onset of the symptoms. Then these are till now we are talking about the histories. So these are some conclusion. I think I already told about this, so I just want to skip this slide. Then comes inspection. You should have to do a proper inspection of the patient in a standing position, and go for gait, posture, facial expression. If there is any deviation from the normal curvature of the spine, whether it is scoliosis, kyphosis, or lordosis, then whether there is a muscle wasting of the paraspinal lower limbs, because we know that the spine is erect due to the it is because our muscles, ligaments are properly making the balance of the spine and making the posture of the spine erect. When there is a weakness of muscles, then that may result in the uh, malalignment of spine, and cause of back pain is also there. And even weak muscles can cause back pain. So there, this also you have to note. Muscle spasm, in many cases, acute case of disc bulge, disc herniation, there is, along with head bulge, there should be an inflammation. So to prevent maximum movement here, muscles will have spasm, will adapt for that muscle spasm. The posture of the patient also change. So this also we can got from the inspection. Then palpate the spinous process, curvature of the spine, then muscle tone, any swelling, any growth, any tumor-like structures, and palpate the spinous process for proper alignment, and then any kind of tenderness, then in kind of signs of inflammation like warm, like that we have to do in palpation. Next, go for the range of movement also. So range of movement is very important for diagnosing the uh, cause of the low back ache. So the range of movement, there are lateral bending right and left, and extension and forward flexion. This are only four movements are there for spine, lumbar spine I'm talking about. Then we may get a partial articular pattern with or without deviation in painful arc movement, end of range painful. Then a full articular pattern or full range with a no pain. This may be the pattern we may get while doing the examinations. So everything we can get a conclusion while doing the examination. For example, if we are one or more movements painful, but other movements are less painful or not painful, then the chance of disc protrusion is more. Then flexion and extension is grossly affected, but the side flexion, it is only painful at the end of the range. Then it may be due to posterior central disc protrusion. Then if it is a unilateral gross protrusion, affected side lateral bending will also be affected along with the flexion and extension. Painful arc movement, if there is always means that fragment of disc shifts, and it causes friction between the dura mater, and it may cause painful arc movement. At a particular arc, the pain will be there. After that, the pain will relieve. Then end of range means common symptoms. A small disc protrusion, it is end of range movement. Means it is till the end of the range, there is no pain. After that, there is some sort of pain. It may be due to injured muscle or sprained ligament or capsule also. So full articular pattern means pain all over the movements. All movements are painful or restricted in a uniform pattern. Then it is mostly due to arthritis, fracture, or malignant disease. So there will be gross limitation. But in elderly patients, it is quite normal that there is gross limitation of the all movements. Otherwise, it is a sign of non-activity related spinal disorder. And there will be no pain throughout the movements in all side movements like flexion, extension. Everything is painless. Then there may be chance for self-reducible disc protrusion. Because at that time, while we are examining the patient is, especially if the patient is coming in the morning, and it have self-reducible, means she have the disc protrusion. If the spine is stable, then it will self-reducible. It will correct by itself by some kind of posture, taking rest like that. Then after that, the pain will disappear. And while we examine the patient, there is no disc bulge, and we will all the clinical signs will be negative at that time. And in some cases, activity or range of movements of the spine will not be affected in case of referred pain also. In such cases, also we have to take care. Ligamentous or postural syndrome also, it will trigger only with the cases like that, walking or standing for long time only. Then at that time also we may not get any proper clinical signs positive, or the range of movements will be completely intact. Even spinal stenosis, I also I said previously that the patient is having pain during standing or walking. Otherwise, all the postures or any movements will not provoke the pain. So this is a common symptom of spinal stenosis. Then a typical, excuse me. So there are other tests also we have to do for diagnosis. That is, one is distraction test. It is especially done to exclude sacroiliitis, and it is doing like that. The doctor has to press the hip joint of the patient at the anterior superior spine, and then downward and outward direction, and should be evenly distributed. Then if it is acute case, then better to place the forearm of the patient and below the lumbar region in acute lumbago condition, if you are suspecting, because otherwise it will create aggravation of the pain. We can't manage now at that time. Then if it is unilateral pain, strongly suggests indicate that a sacroiliitis, or central pain if there is, it may be due to disc regions. Hip joint, all the movements of hip joint also have to done, because it may be important to differentiate between the lumbar spine and hip joints, especially in the case of pain in one buttock, and or the patient is having anterior thigh pain. It may be due to hip joint also. Mostly the sciatica patients or patients having radiculopathy are complaining of pain in the posterior thigh regions. If the patient is having anterior thigh region along with pain in buttock region, that may be due to any causes from hip. So here hip joint examination is also important. Next is straight leg raising test. It's a very simple test. This is having high sensitivity to rule out the sciatica. So SLR test may be positive in, I know everyone know how to do straight leg test, so I'm not explaining more. But it may be positive in intraspinal lesions, that is disc protrusion. Non-discogenic lesions like tumor or neuroma also show a positive SLR test. Then extraspinal lesions, sacroiliac joint lesions, major lesions at buttock, hip joint, hamstring muscles, or tight hamstring muscles also cause difficulty in raising the straight, raising the leg. So there are confirmation. We have to go for that distraction test and test for hip joint to confirm the diagnosis, or for any other further investigations. Then I'm just talking about some diseases. This is around the degenerative disc disease. There are some phases of degeneration. Accordingly, we may get different clinical sign also. So facet joints dysfunction is the first thing. Then in the phase 2, the joint capsule laxity will be there, and facet joint subluxations will be there, and there will be subperiosteal osteophytes. Then next stage, periarticular fibrosis and osteophytes will be seen. So accordingly, the clinical presentation will also change. Restricted movement in the initial stage, then it causes increased movement or unilateral radicular symptoms along with that. Then in the final stage also, there is complete restriction of the movement, and there may be stiffness of the back also. These are some X, X-ray changes. I think you can see this. Just a minute. So here in the first stage, cervical spine and lumbar spine are there. This vertebrae is smooth, perfect alignment is there. Then normal curvature, equal spacing are there, and even you can see this opening of the neural foramina, which allows the nerves without any interference. That is the first stage. It is the normal stage, and in stage two, here that is lack of mobility and fluid prohibition of the fluid to pump and disc become desiccation. That is, it will become thin. There may be thinning of the disc. The curvature may be loose and the narrowing of the neural foramina, little bit narrowing you can see here. Then pain and fatigue may be the feature here. Then in the next stage, there is significant loss of the this space is you can see in this both significant loss of curve and this space, reduced height of the vertebrae, and calcium deposits, osteophytes are there. Spur, here we can see the spur. Okay. In that case, the patient may have constant pain and difficulty movement. Sorry, there are some disturbance from outside. Then come to intervertebral disc disease. The main thing we are facing, it may be due to any degenerative causes and inflammatory causes, any strain, trauma, anything may be the reason. So there are some terms you may heard from many MRI or in textbooks. We can see many terms. Actually, want to differentiate what this means. This desiccation, this bulge, this herniation, extrusion, protrusion, sequestration. Many terms are there. While reading an MRI, we may see this kind of terms. So we need to know what is this actually. So let me tell that disc desiccation is nothing but this is the first sign of degeneration. The fluid it will become begin to lose their fluid. I already told that disc is a jelly-like substance which contain 90% of water, and it become dehydrated and we lose their fluid, and elasticity will lose at that stage, and maybe thinning of the disc also there. That is the disc desiccation. Here you can see this is this desiccation. Here it is this bulging. This bulge means have you remember that two structures of the disc, where the outer covering is the annular fibrosis and nucleus pulposus is the inner jelly portion. Here in disc bulge, the annular ring will project from beyond its normal margins, but the membrane will be intact. There is this sacs looks like it's bulging outward, but the outer covering, that is annular fibrosis, is intact. There is no break in the or tear in the annular ring. That is this bulge. This may be a circumferential or asymmetric bulge. Sorry. So, then about herniation, outer covering has a hole or tear and causing the nucleus pulposus to leak into the spinal canal. That is herniation. This herniation. So disc herniation का both categories दिया हुआ है, protrusion, extrusion, sequestration, and one is Schomol's node. Protrusion means focal herniation of the disc beyond the margin, but of the adjacent vertebral body, and less than 90 degree means वो जो disc है उसका I can show you. Yes, here it is. ये जो margins है ना वो ये एक्सट्रूशन है, मीन्स मोर देन 90 डिग्री से ज्यादा ये बाहर नहीं आएगा, लेस देन 90 डिग्री आएगा। ये जो आप ये राउंड एक्सपेक्ट कर रहे हैं ना, ये जो एंगल है, जैसे ये नॉर्मल है, ये जो एंगल है उससे ज्यादा, उस वो 90 डिग्री से ज्यादा नहीं है तो डिस्प्रोट्रूशन बोलता है, 90 डिग्री से ज्यादा है तो एक्सट्रूशन बोलता है। सेक्वेस्ट्रेटेड, सेक्वेस्ट्रेशन मीन्स डिस्टल माइग्रेशन ऑफ द एक्सट्रूडेड डिस्क, मीन्स वो वहां से फ्रैगमेंट होके दूसरी जगह पे जाएंगे, दैट इज सेक्वेस्ट्रेशन। मीन्स वो पल्पोसस जो बाहर आता है वो फ्रैगमेंट होके दूसरी जगह पे जाके बैठेंगे, दैट इज सेक्वेस्ट्रेशन। दिस आर सम स्टेजेस। एंड शॉमोल्स नोड मीन्स कई जगह पे ये प्रोट्रूशंस है ना, उसका जो कैल्सिफाइड फॉर्म मिल जाती है, दैट इज शॉमोल्स नोड। Many of the time it is asymptomatic only. Then comes to radiculopathy. One thing you have to remember that I'm saying about different conditions, but never think this is our isolated conditions. Even a degenerative disc disease can causes radiculopathy. A degenerative disc disease may be cause herniation. So like that, you have to connect these things. Not isolated conditions are there. Everything may be coexisting. Okay, one may be the reason for the other. So that thing you people have to remember. Radiculopathy means when the herniated disc or the disc may compress the nerve root. You know the spinal nerves are there. If it compress the nerves or nerve roots, then it causes signs of neurological signs like pain may be there in that specific dermatome. Then numbness may be associated. Tingling or pins and needles may be the presentation of radiculopathy. According to the area affected, it may be cervical, thoracic, or lumbar radiculopathy. So I just give a pictorial representation what happens when L4 nerve root is affected, L5 is affected. You can see the area, like the distribution of the pain. If it is L4, then through the lateral sides of, then and going to anterior thigh, then medial part of the leg. Here, if it is L5, proper sciatica distribution, you can see L5 and S1 regions. In S1, feet will be affected. If it is L5, feet will not be affected. Then motor weakness may be associated, especially the muscles which are supplied with the nerve root. Likewise, if it is L4, extension of quadriceps will be affected. If it is L5, dorsiflexion of the great toe and foot will be affected. Then plantar flexion of great toe, that may be foot drop, like that in S1 root compression. And we have to do the examination. If the patient is having S1 nerve root compression, walking on toes will be affected. Then heel walking will be affected if a patient is having L5 weakness, L5 pathology. Then squatting will be affected in L4 compression. Then reflexes, knee jerk will be diminished in L4, ankle jerk will be diminished in the S1 root compression. These are very simple tests, and by which we can know the exact region where the problem is lying. Similarly, in case of cervical radiculopathy also, based on the area affected, the affected part will be changed. It is given as a color code here, and C4, C5, C5 root name, which area is affected, it is clearly given here. I'm not giving more stress to cervical conditions because of lack of time. Sorry for the inconvenience. Then comes to spinal canal stenosis. Spinal canal stenosis means if there is narrowing of the spinal canal, and it may be lateral recess stenosis also. That is a lateral recess which causes exiting nerves. Then it is it may causes much serious illnesses like tingling sensation, pins and needles, a claudication of the hands if it is affected in the neck. Then it may also affect the balance if it is a cervical stenosis. There may be weakness, walking and muscle weakness and balance problems if the cervical portion is affected. In lumbar stenosis, standing or walking will be affected. The patient experience a cramping, claudication like pain. Have to differentiate it from vascular claudications. In the similar manner, it is present like claudications. The patient got improvement after bending forward or taking rest or sitting. That is a common presentation of the canal stenosis. And here spondylosis and spondylolisthesis, what it differs. Spondylosis, degenerative changes in the spine, and spondylolisthesis involves the displacement of the vertebrae where one bone slips forward over the other. It may be result from untreated spondylosis. If one disc, if it is weak, then it causes spondylolisthesis also. Both condition may coexist. So I think a brief introduction, I took more than 1 hour for a brief introduction. Then coming to Ayurvedic perspectives, here I think uh, I'm included some case from experience so that we will discuss about that. Then Ayurvedic perspectives of low back pain, I'm discussing more here. It may be Gadavada, Gulma, Asha, Grahani, maybe Gridrasi, Katigraha, whatever it may be. It may be associated with Ama or a Shofa. So there is no particular diagnosis for this. That is, sciatica is always be present like Gridrasi only. It may be Gridrasi, but associated with other features if there, then you have to go for other line of treatment. If the patient is having any constipation, the abdominal distension, then Gulma Chikitsa will be more effective in the first line. The next line you can go for Vasti like that. But in the first line, you should have to take care of the Ashaya, then Dosha, Dushya, and other associated features. And even Bala of the patient also have to take care. So for the diagnosis in Ayurveda, you should have to consider many factors as usual, that the Prakriti, what's the lifestyle of the patient. One of the major reason of back pain in females is it is Vegarodha, Mutra Vegarodha. Many patients have developed back pain due to this habit of suppression of the urges of like urine and stool. And regarding lifestyle, occupation, and posture, also we have to ask. Then, based on that, we have to make the Sambhrakti. What is the dosha involved? What's the pathology? If it is Shayajanya, Vadavyadi, Avrana, Janya Vadavyadi, whether it is a simple Vadakopita Lakshana, whether it is an Apana Vaikunya Lakshana, whether it is a Agni Vikriti only. Even we can see the Kadigraha is a feature in Vishujiga, Grahani, Ajirna. In many cases, we can see the Kadigshula, Katigraha, Trigaprishta Kadigraha. It is a symptom, as a symptom in many diseases. So just inquire about the patient's Agni, status of bowel and bladder functions. There we can conclude about Agni of the patient and Apana Vaigunya is there or not, whether it is whether the back pain is due to that. And along with some clinical examinations like tenderness, if it is a localized pain, it is a central pain, if it is a paraspinal pain, then the conditions will be different. If it is a paraspinal tenderness, it may be due to muscle strain, and we have to not treat for the Asti Poshaga drugs. You no need to use such kind of drugs in such cases. Just give him a Pajana, then go for Abhyanga Svetana to relieve the muscle tension. Then it will relieve by itself. Then advise correct posture and lifestyle. Then that condition will be cured by within a few days, 1 or 2 days. It will be okay. If the patient is having low backache, having morning stiffness, then it features of ama, like the patient has a lack of appetite, vipanda, mala, vitgraha, Vada Vibandha is there. Then severe stiffness is there. After sitting for a short time, then getting up from that position, the patient may experience severe stiffness, and along with the pain, patient is having stiffness. Then think about the association of kapha along with vata. So, not Katibasti is not the treatment of low backache in all cases. There you have to go for the condition. What is the state of doshas there? If it is Samanvita, Nirama dosha, and if it is Kevalavata or Samsargaja or any other factors are there, even a small clue can cure the disease very fast. Then Lakshana Samutthana is, as I told earlier, it is very important. Even Gridhrasi is Vata or Vata Kaphaja only. But in normal scenario, we can see many types of Gridhrasi. There may be some association of Pitta, and the patient is having severe burning sensation. Then we know that it is not Kapha and it is not Pitta also. Sorry, it's not Vata also. That means there is some association of Pitta or association of Rakta is there. Then at that condition, we have to think about some maybe Kashol Gugulu will act more, Rasneranta they will act more, and Nagaradi Lepa will be get a fast relief. Otherwise, Rekta Mokshana we can do in that cases. If the patient is having severe spasm, then Agni Karma is the best option. Spasm of the muscle. Then simple Abhinga Svetana, Abhinga and Nadi Svetana will relieve the muscle spasm at a glance. Then such as small observations, small understanding, we can that may give good results in treating back pain. So it is also important though Shamsha Kalpana of doshas and Roga Avastha and Rogi Pariksha is very important. Then Ayurvedic treatment principles include it is not a common protocol. It is depend upon the patient presentation, state of the patient, and at what stage the patient is came to us. That all depends, and it is not a common treatment protocol. You have to use your yukti. You have to use your indriyas to analyze the dosha and other things. So I'm just seeing if there is ama, then ama pajana should be done. Am I audible? Am I audible? Hello? Yes, yes, audible. Okay, okay. Actually, my network, I got a call, then network was disconnected. Okay. Let me continue. Then Amapajana, if the patient is having severe stiffness, kapha association, Gaurava, Tantra, Arojaka, then the treatment should be start from Amapajana, Dipana. Not go for direct Kativasti in that condition. So whether it is IVDP, whatever may be, if it may be sacroiliitis, if it may be spondylosis, spondylolisthesis, whatever it may be, give proper Amapajana, Shopahara Chikitsa, Agni Deepana, and think about the dosha. If there is need for Vatanulomana, give some Vatanulomana medicines. In earlier stages, if it is AMA association, don't go for Thaila preparations like Erinda Thaila. But in later stages, if AMA is not that much dominant, the patient has good appetite. Erinda Thaila we can give in AMA condition also. But if the patient is having good appetite only, then we can give Erinda Thaila. Otherwise, prefer Churna like Haritaki, Erinda Prishta Haritaki, like Trivachurna, like for simple Vatanulomana medicines you can give. Even Lavina Bhaskara, Hingu Achadi Churna is also giving, having good results. Especially the patient is having Udavata symptoms, constipation or urinary discomforts, then Hingu Vachati Churna is a good option. It will do Amapajana, Agni Deepana, also Vatanulomana. Even Ajamotadi Churna is also having the same property. Then go for Nitana Parivajana or modification, especially includes the posture correction, diet modification, and if it is due to any muscle strain, then advise proper exercises. Don't go for vigorous exercise in case of disc herniation or protrusion without considering the site or level of disc herniation. It should need some exercise pattern, but it should be after considering the condition of the patient. In acute conditions, avoid exercises. And for even some of the patients may present acute lumbar pain due to annular tear. The pain may be starting after weighting heavy vehicles or bending forward. The patient cannot move at for some time, and severe pain will cause after twinges will be there and can't tilt the body even. That is annular tear may be there. In such conditions, don't go for traction or other severe massage techniques. Yes, Svetana will not be done. Only you can give Svetana using hot water bag or mild tapasveda you can give, but don't go for don't apply more pressure in that conditions. Even traction is also prohibited at that condition. Only a stable spine you can go for such treatment methods. Then that is regarding Nitana Parivarjana or that. And even stress management is also important if you are considering the patient is having a psychogenic factor which may aggravate the condition of the patient. Then you have to consider managing the stress also. Then Brahmana and Asti Mamsa Bala Vriddhikara Chikitsa we can done in the next stage. Then using Basti means Yapana Basti, you can Panchatikta Kshira Grida Basti. Then Rasayana Chikitsa like Lishna Rasayana, Shila Jitu, accordingly you can give. Then key to diagnosis always multifactorial, and every case is a new case. Every patient is a new. Don't compare it with previous case. Maybe something new in that patient. So a common protocol will not be successful for the same case scenario. Then assess the dosha, amavastha, status of Agni, Rogabala and Rogibala. Take care of the red flags as we discussed earlier, and rule out the other systematic causes like TB, then ankylosing malignancies. You should have to rule out. Then clinical examination is that's why it is so much necessary. And if needed, you can go for investigations. No need of MRA even at the beginning. If the pain is having remission after doing some measures, then it is not needed to do MRI. But if you have the patient is having a cauda suspicion or otherwise any other systemic illness associated, then go for MRI. So Nitana, as you all know, I'm not explaining these things. The main thing Vishama Dupacharacha, then Dhatunam Samshaya Chinda Shoka, Rogadi Kashana, Dveka Sandarana, Marma Vadat, Gajoshtra, Ashwa Shigrayana, Apatam Sanadin. Means patients having chronic back pain, those who are riding in bikes regularly for a long time, the patient is some that kind of patient also present with back pain. So everything in was there in our Samhita. These other courses now also. And in Samprapti, it may be due to Samsarga doshas, maybe due to Avrana of Vayu due to other doshas, or maybe due to Purisha, Anna, anything else. Then Avrana is also a Samprapti you have to consider. So in that case, you have to go for, first of all, Avraga dosha should be removed, then go for Vata Shamana Chikitsa. Don't think Abhinga Svetana Katti Kasti is the treatment for low backache. If a patient is presenting with low backache along with abdominal distension, then abdominal distension is there, constipation is there, then urinary discomfort is there, any kind of, then it is a Pakvasyagadavada. As I told earlier, here also I have enlisted many conditions like Pakvasyagadavada, Astimajjagadavada, Avranavada, Annavritavada, Purishavritavada, Snayugadavada, then Astimajjakshaya, like that, Gridresi, Khalvi, Kati, Graha is there. Many conditions are there, but don't think this may overlap. The pathology of Gridresi maybe start from a Pakvasyagadavada. That is possible. These are some pathological events. Gridresi is a disease. Then other diseases also can cause low backache. So don't think these all are isolated conditions. Even Avrana Samprapti and Kshay Samprapti also coexist. It is depends upon the patient's chronicity, nidana, like that, but it may also possible. So these pathologies may coexist. Then Gridresi have a clear picture like that. Sciatica should have to differentiate if whether it is Vata alone or along with Vata Kaphaja. Then treatment, as you know, Agni Karma, Siravedha, anything you can do, and along with the Basti thing we will discuss later. Then Dosha Vikalpa according to Madhav Nidana, Vadajayam Bhave Todo Dehasyabi Pravakrata Janu Katti Uru Sandhinam Spuranam. Spuranam, we can correlate it as paresthesia, pins and needles, like that. That is Spuranam. Stabdada means inability to move the limbs. That is Stabdada. It is not stiffness. It is maybe correlate as loss of power, motor weakness of the muscle. It is Stabdada here. It is not the Stambha. It is Stabdada. And there are some difference. Then Vada Shleshmodbhavayam tu Nimittam Vanni Mardavam Tandra Mukha Prasegascha Bhakta Dveshas Tadhevacha. That means Vanni Mardava means that there should be an associated feature of loss of appetite or Annadvesha. Then Tantra will be there. Patient is having some kind of features of Kapha. That is any features of Kapha, if it is there, then it is in Samsargaja Gridresi. Treatment Andhrakantra Gulfam Siravasti Agnikarmacha Gridrasi Shuch Prayunchita Galyam Tushna Upanahna. Then सुश्रुत ने सिरावित करने के लिए बोला है. Then all Vadavyadi Chikitsa can be done. So it is clear that Avarayukti is the main thing we have to use here. So identify the condition. So let us discuss some cases. Just a few months back, the patient was admitted in NIA IPD, and it's a female patient, 45 years old, and there is no history of previous history of back pain, and she's a non-diabetic, no-empathetic case. And she had a history of chikungunya fever, and related joint pain was there. But the pain was started suddenly 2 months ago. Then severe low back pain it was, and it is debilitating pain, which is radiating towards the left lower limb through the posterior aspect. And she was literally bedridden in last 2 months. Even after taking many medications, analgesics, NSAIDs, even steroids also she had taken as per the prescription. But the patient is even can't walk without support. उनकी जो बेटी है उसको व्हीलचेयर में लेके बाथरूम वगैरह जाते थे, बाकी कोई मूवमेंट्स नहीं कर पाते थे. सो एसएलआर कर नहीं पाया. टेंडरनेस था L3, L4, L5 में, बिकॉज एसएलआर तो बिल्कुल फ्लिकरिंग मूवमेंट है, फिंगर बस थोड़ा सा फुट ऊपर कर सकते थे, इतना ही था, इससे ज्यादा नहीं था. एंड MRI shows annular tear disc herniation at multiple level. and VAS score was at the time of admission, it was 10 out of 10. Diagnosis was done according to the presentation. The patient is having stiffness, then Toda, Spantana, Kati Pradesha Vedana, and through the posterior thigh, and inability to do Satyukshepa, Nikrinadi, Gridrasija. Then associated with Gaurava, Aruji, and disturbed sleep due to pain, and the patient is having a severe feature, means dominant features of Agni and we start Ama Lakshana is also there. She used Thaila to apply, but even after that, the pain aggravated. That condition we started with Amapajana with Akmodadi Chuna and Nagradi Kashaya, which contains Nakara, Aritaki, and Guduchi only. And it is a good remedy for initial Amapajana and Doshavasejana. And again, saying it is a preparation mentioned in Jwara Chikitsa. It's also known as Amritotram Kashayam. It's like a Amrita because in the initial stage, it will do fantastic Amapajana. I am saying the words fantastic because that much effective it was. 3 medicines only we can make the preparation in our OPD setup or IPD setup. But it is initially it will do Shofahara, Amapajana, and Doshavasejana. Along with I think Simanath Buglu also given. Then Shofahara Lepa with Kottam Chukati was also given. Then pain reduced and patient become able to walk with support by 5 days of treatment. Along with improvement of the appetite, and she was able to sleep after 2 months. Even now, I remember that the patient says, I slept yesterday, that day. That was a gift for us. Then second stage, after that, Amapajana, and then internal medicines we continued, and Ruksha Sweta started with Kolakulatadi Churna. We didn't use any Thaila or even Abhinga. Svetana was not done. Just for Ruksha Sweta we did. Kolakulatadi Churna. It is not Snigdha, but it will elevate Vata and also elevate Kapha also. Even better we can use in Ama conditions also. So that we prefer Kolakulatadi Churna. Then continued internal medications. Leba also continued. After that, Koshta Shodhana was given with the Gandharvastati Erenda Thaila continuously for 4 days. So for that, a 40 ml Erenda Thaila was given in empty stomach. As a Nitya Shodhana, it was a Nitya Anulomana. We have given that Gandharvastati Erenda Thaila. In this condition, actually, Sindhuvara Erenda is far better. Sindhuvara Erenda is it is Erenda Thaila processed with just Nirgundi Swarasa. That in this condition it is far better, but here it is not available in Jaipur. So that's why we opt Gandharvastha there and Thaila. It's also a good thing. Then third stage, we go for Erendamuladi Niruha, Sarajiradi Thaila Nivasana. Then started Abhinga and Patrapinda Sweta. At that time, that was Upashaya. It indicates proper clearance of Ama. And then Brahmanavasti was started after that, Yapanavasti, Panchatiktigratakshira was given. Then along with that, Khatti Vasti also. At the end of 1 month, she got discharged without any pain and she was walking without any support and with good, she was, initially she was so depressed. That was also relieved after the treatment. She was so happy and sleeping also improved. Then this is the next case having lateral recess stenosis at L4, L5 level. The patient is typical presentation that after walking a few distance, like nearly 20 meters, the burning sensation and pain, tingling sensation of the left lower limb is present. Then the patient was Pravara Sattubala patient and even Dehabala is also good for this patient. So we have started from Koshta Shodhana only. There are no symptoms of ama as such. Then Koshta Shodhana was given with Gandharvastha Erinda Taila for 3 days continuously. Then we started Abhinga Svetana along with Patrapinda Sveta. After that, Patrapinda Sveta and Yoga Basti. Yoga Basti was given with Dashmula Niruhan Sajradi Taila Anuvasana. Then Kati Basti with Murivanna and Palashogandha Lakshati internally. Murivanna is actually the patient had a history of trauma and vertebral fracture was there. So that's why I add Murivanna along with Palashugandha Lakshadi Taila. Bhagna Chikits also included here a little bit. Then internally, Ashwagandha Gotangi Panchkola Churna was given, Cyclone capsule. It's a proprietary medicine. Dashmula Kashaya and Trayodashangal Guglu. After the internal medications, we started Lashuna Rasayana. In between, one Koshta Shodhana also given with Gandharvastha Erenda Taila only for 1 day. Then started Lashuna Rasayana. It is we given in the Vadamana Kalpa along with the Murchita Tirthaila. So Vadamana we started from, I think 3 gram Lashuna was given in the first day. The patient well tolerated with Lashuna, one of the best patient because the tolerance capacity. That's why I told that patient was Pravara Sattobala. Even at the maximum dose also, the patient doesn't have any kind of difficulties with Lashuna, well tolerated with Lashuna. And I think the 36 gram Lashuna was maximum was the maximum dose and continued for 20 days. And along with Musida Tilataila was dose also increased accordingly. It was taken 3 times the Lashuna. That means for 3 gram Lashuna, we give 10 ml Lashuna Taila like that. Sorry, Musida Tilataila we given. Then diet was totally restricted because Shirotana, we give Shirotana for whole Rasayana Kalpa. And the patient got very significant relief in that pain after the treatment. Then during follow-up, Sajrati Kashaya and Brihatvat Chintamani Rasa also given because of association of slight burning sensation was there. Then Trayodashangu Guglu, Cyclone capsule continued. After the follow-up, Sajrati Kashaya was changed as Sajrati Taila capsule. So internal administration of Taila is having fantastic result than external administration from my experience, I think. Internal administration have fantastic result. Whatever may be the Taila, even Guglu, that Sajrati Taila, Dhanundra Taila, that we can use in such conditions, especially if there is a neurological involvement, then you should have to give Taila internally. I'm not telling about external application, but internal use of Taila will give fantastic result. So next case, we can see acute pain of low back, difficulty to move side to side even. There is severe muscle spasm, adaptive posture was there. Forward and backward flexion is severely painful and restricted. And there was tenderness in L5S1 region. Slight feverishness was there. Stiffness was there. Pain more during morning. And in this patient, we done all the investigations for ankylosing spondylitis, CSR, CRP. Everything was normal. But the bowel was constipated also. And we treated this like a Jwara Anupanda disease only and completely Ama Chikitsa, Shofahara Chikitsa was given. Nagrati Churna with Marma Gutika was given with in Nimpuresa for Lepa continuously for 5 days. Then Duksha Seta was given. And in the same day of Svedana, got complete significant reduction of muscle spasm in the same day only. And then medicine Sanjeevani Vadi Samanad Guluchadi Kashaya. Guluchadi Kashaya is having some, it is also a Jwara Adhikara medicine. So initial stage, I always prefer to use medicines from Joradhigara. Then pain reduced by third day and continue. Then we shifted to Sneha Chikitsa, Sneha Sweta, and Kati Piju with Lego Shagarpataila was done. Within few days, a result was. This is some acute conditions and some another lady with LPA which is not responding itself using Thaila. So in that case, we given Dasana Saptakashaya and Yograj Guglu, Sudarshanasava and Punanamasava and Pancharasana Churna. Pancharasana Churna is having fantastic and analgesic property. You can use. Actually, I don't know. It was previously available in North India. I didn't see this preparation. Churna Pinda Sweta and Lipa with cotton chukadi churna was given here, and the patient got significant change in pain. Then one of the another case with L4 L5 disc protrusion, and the patient had a history of loads of bike journey. So considering a severe Vatakopa in the Pakwashaya, we started Erenda Sukumara Taila and Rasna Saptakashaya with Ugraj Guglu and Dashmul Haritaki Lekya, which is Shofahara and Vatanulomana. And there was a hemangioma at D8, D9 level, but for that we can't do nothing. And just application of cotton chukati karpurati and murivanna was given in that case. So some cases I think I discussed. I think I took more time. It is 7:36 already. Just concluding this. And then comes to exercise. I already told exercise should be cautious. Maybe you can seek the help of a physiotherapist for advising proper exercise. It should be a proper position. The patient should be stable. If there is pain, then advise the patient to not to do exercise. We can go for yoga like Bhujangasana, Shalabhasana, Sedubandhasana. These are somewhat safe, but if a patient is having posterolateral disc protrusion, Bhujangasana may trigger the pain. So even posture correction also we can say like this. This will also reduce muscle spasm and proper alignment of the spine also relieve the muscle tension. So correct posture is an important thing. We can do various panchkarma like Vastikarma, Kati Vasti, Gripa Vasti, Virechana. Nasya therapy, I included it for cervical pain actually. Lepa Chikitsa, Griva Vasti, Nasya therapy. If needed, Shirodhara also we can do in cervical conditions according to the stage. The stage, everything it is similar to that low backache only. Additionally, we can say some Ajirna cases like Vidagdha Ajirna and cervical spondylitis cases are very more. That may not be spondylotic changes, there was not that. But the patient is having severe muscle tenderness, pain, fasciitis, like that. In that cases, most of the patients are seen in the OPD present with the Vidagdha Ajirna or Amlapitta like symptom. So first of all, treat the Vidagdha Avastha, then automatically the symptoms will relieve. And this kind of patients may also present with the headache also. This is a common presentation, and stress is also a factor in this condition. So treat for that also. So in that condition, we can go for Shirodhara Nasya and some Medhya Rasayanas and stress relieving Ashwagandha like medicines we can use. Then Gripa Vasti, if it is a Shofa condition, Ama condition, don't go for Griva Vasti. Lepa Chikitsa is far better. After that, you can go for Griva Vasti with Balashugandha Lakshati, Dhanundaram, like Prapanchana Tailam. There are a lot of Tailas available according to the need. Then for internal use, better Dhanundaram Taila is good. Prapanchana, Maharaja Prasaranyadi Taila is good. Avarti capsule is available. Even Avarti Thaila is also available. Then Siraveda, if there is severe inflammation, spasm, then you can go for Siraveda. Tenderness is there, then Siraveda will give fast result. Agni Karma, same muscle spasm, it will immediate relief of muscle spasm also while doing Agni Karma. It will also reduce tenderness. I don't know the mode of action of Agni Karma in this condition. It is saying in many paper that it will deviate the body's attention towards that area and reduce circulation and causes reduction in inflammation. I don't know much about that. But in one or two cases, I got a reduction in the initial symptoms, acute symptoms, by using Siraveda and Agni Karma. Snehasweda should be according to the condition. If it is associated with some sort of kapha, then choose for Manarayana Taila. Like if it is Pitta associated, Shirabala Taila, Pinda Taila, you can go for. Likewise, choose the Taila and mode of Svedana according to the patient's doshavastha. Pirichil it is a oil abhinka only, but it is very snigdha and it will provide strength to muscle also. So as I told earlier, muscle is the main thing. Muscle strength is the main thing which gives proper alignment and पोजीशन में रखने के लिए, वर्टिब्रल कॉलम को पोजीशन में अलाइन करके रखने के लिए मसल का जो रोल है वो बहुत इंपॉर्टेंट है. इसलिए वहां पे आपको हमेशा जो स्टेज आप पूरा इन्फ्लामेशन वगैरह ट्रीट करके तो नेक्स्ट स्टेज में हमेशा ब्रह्मांड के लिए जाना है आपको. वहां पे मसल स्ट्रेंथ बढ़ाने का जो मेडिसिन आप यूज कर सकते हैं. नर्व न्यूरोलॉजिकल डेफिसिट्स है या कोई रेडिकुलोपैथी है और कोई फ्रैक्चर है, वहां पे आप लेशनल रसायन अच्छे से यूज कर सकते हैं. भग्न खुडिलव अस्थि में लेशनल रसायन आप यूज कर सकते हैं, बट डोंट यूज इन ए कंडीशन विच इज एसोसिएटेड विद पित्ता और रेक्टा, लाइक इन्फ्लेमेशन है, बर्निंग सेंसेशन है, पेशेंट इज हैविंग एनी अदर पित्ता सिम्टम्स लाइक गैस्ट्राइटिस वगैरह है, तो वहां पे लेशनल रसायन ज्यादा यूज नहीं करना है. और ऑल्सो केयर अबाउट द डोज. जहां पे पेशेंट को डिस्कम्फर्ट स्टार्ट हो रहा है वहां पे आपको डोज कम करना है. ऐसा नहीं है आपको इतना लेशन देना ही है, ऐसा नहीं है, बट आपको वो डोज अकॉर्डिंग टू द पेशेंट्स कंफर्ट ये करेक्ट करना है. और डाइट भी आपको उसके अकॉर्डिंगली रखना है. शिरोधन इज द बेस्ट थिंग, वो भी वाइट शाली बताया. जैसे पिपली वगैरह देते वक्त वहां पे शास्त्रिक शाली बोला है, बट लहसुन के जगह पे श्वेत शुक्ला शाली ऐसे कुछ बोला है, मीन्स व्हाइट राइस बोला है, विच इट इज मोर कफ वृद्धि थोड़ा बढ़ाते हैं. और एट द एंड ऑफ लेशनल रसायन यू शुड हैव टू गिव सम पित्ता रेजना, मीन्स विरेजना you should have to give by using Trivitta Vliha, Kalyanagula, like that you can use. So remedies, some medicines are there, but everything you should have to use according to the condition. If it is Amavastha, is there any association of other dosha, go for Yograja, Samanada Guglu. Trayodasham Guglu, it is containing a Shugandha Shatavari, like Vidari, like Aushadas. It is Madhura Snigdha Guru, and it will give Brahmana. Rasnadi Guglu, in between condition we can use. Kashor Guglu, if it is association of burning sensation, then inflammation is there, tenderness is there, then Kashor Guglu can use. Lashun Kalka, Nirgundi Swarasa. Nirgundi Swarasa is also a good option. Many times it is available also. And severe conditions, we can use Nirgundi, Shefalika Patra Kalka, Mahanimba Kalka. I haven't used actually Shefalika or Mahanimba, but Nirgundi I have used. Even Lashuna also I have used. It's good result. Then Ajmodadi Churna, Abhyadi Churna, Ingwajadi Churna, कोई भी चूर्ण है अकॉर्डिंग, जैसे आपको दीपन चाहिए, आमपाजन चाहिए, या वातानुलोमन चाहिए उसके अकॉर्डिंग आप यूज करना है, और एसोसिएटेड जो कंप्लाइंस होता है, जो आत्मान कॉन्स्टिपेशन सब सोच के मेनी टाइम्स गुलमाधुर के जो मेडिसिन हम बहुत अच्छे से यूज कर सकते हैं, पक्वाशगतवाद चिकित्सा हम कर सकते हैं। वहां पे हम चिरगुलादि यूज करो, गंधर्वस्तादि कषाय यूज करो, रसना सप्तक, रसना पंचक, ये सब अकॉर्डिंग टू द कंडीशन। जैसे थोड़ा सा सामे संध्यस्ति मज्जे आपको रसना सप्तक देनी है, रासने एरंडादि वहां पे शोफा ये टेंडरनेस वगैरह है तो रासने एरंडादि में जाना है। रसना पंचक भी थोड़े बहुत आम के कंडीशन में आप दे सकते हैं। इसके साथ आप ज्यादा पाचन की जरूरत है, रासना सप्तक के साथ शुंडे शून्य दे दो, अदरवाइज योगराज गुगुलू सुमनाथ गुलू कुछ भी दे दो। महारासनादि कषाय इट इज नॉट डोंट गिव इन आम कंडीशंस। Maharasnadhi, even Sajradi also. We can give along with the Thaila capsules or Thaila or with the Mahayograj Gugulu according to the condition. Then Sajradi Kashaya Thaila Vimishritam आपको देने हैं। कोई भी तेल या एरंडा तेल होगा, धनवंतरी तेल होगा, मीन सहस्रादि का भी तेल मिलेगा, वो उसके साथ अगर देंगे तो उसमें फलश्रुति में ऐसे द्रुत विलंबित को भवदीचय, even severe motor weakness, the patient is whether it is having thumb stiffness, anything, tingling sensation, Sajrati is having good result. Gugulu Tiktaga Kashaya we can use if the patient requires, if it is chronic, then patient requires Brahmana, Vata Shamana, and Vata Kafahara, it is that. And पेन डोमिनेंट कंडीशन में दीपा धातु से अफेक्टेड है, क्रॉनिक कंडीशन है, तो गुगलू तिक्तग इज बेस्ट. इट्स द सेम योगा ऑफ गुगलू तिक्तग्रता एज मेंशन्ड इन वातव्याधि चिकित्सा. एंड if there is no the patient is not obese, lean, then you can directly go for guglu tikta. Otherwise prefer kashaya. Obesity is I forgot, I think obesity is one among the aggravating factor. Lumbar lordosis increase in the patient having disc problems or spinal canal stenosis, it with the symptoms also increase. So better take care of the patient's body weight. Should advise some dietary and exercises like walking. Then Dhanantaram Kashaya, it is स्टिफनेस ज्यादा है तो पेशेंट को धनुंद्र कषाय नहीं देना है. वैसे अदरवाइज वीकनेस ज्यादा है और आपको ब्रह्मण करना है, धनुंद्रम कषायम इज बेस्ट. नायोबायम कषायम if the patient is having some features of gulma and pain is also there, there is Agnimandya is there, then Nayobayam kashaya we can do. Ashtavarga is Kevala Vadahara. Then Gugulu I already told. And use of Thaila, Sajrati Dhanvantara you can give, even Brihat Saindavadi also you can give internally. Brihat Saindavadi you can give in that ama conditions, because the Thaila was prescribed in Amavata. The patient is having proper Agnibala to digest Thaila, you can give internal administration of Thaila. And initially go for Gandharva Erenda, Nirgundi Erenda, Nimbamritati Erenda. Nimbamriti Erenda, if there is much dosha is there, Shodhana requires, then Nimbamriti Erenda is better. Then Vadavriddhi is there, then a little bit Kafashamana needed, then Sukumara Erenda, Sindhuvara Erenda you can prefer. Brihat Saintavati also good. Then Sajrati Thaila, it is in the later stages for Brahmana and Kakoshyavata Shamana. Sajrati is better. Dhanvantara is also better. And लघु विषगर्भ ये सब आपको एक्सटर्नल एप्लीकेशन के लिए यूज कर सकता है. गुगलू तिक्तग्रता इज अ गुड कॉम्बिनेशन. इफ द पेशेंट इज हैविंग अपानवाता दुष्टि, सुकुमारी गृदा will be a good choice. The patient is having Agni Dushti, Grahini like features, Agni Mantya, Gulma like features, then Shatpalagrida is a good choice. According to the condition, you can choose various medicine. Even the Saushadis, Vadvidvamsa, Brihat Vachintamani, it is Vatpitta Shamana, very good Vatpitta Shamana, and neurotonic also. Ekangvi Rasa, it's if neurological pain is so severe, Ekangvi Rasa you can give. Vishtintukvati also give good result. Then Sanjeevanivati is good. Even any stage of the condition, Sanjeevanivati will work. Then Arishta, Ashugandha Arishta, Bala Arishta, Abhay Arishta, and Dashmula Arishta, according to the condition you can give. Abhay Arishta and Dashmula Arishta more related to Apanavaya Vaikulya. Many medicines are there. These are some examples only. Just want to give you some examples.
जी, बहुत
Uh,
बहुत धन्यवाद। एक्स्ट्रा ऑर्डिनरी प्रेजेंटेशन। और जब स्टेप वाइज आपने एक एक डिसेक्शन कर दिया ना कि भाई ये स्टेप इस तरीके से, तो मुझे लगता है कि बहुत सारे चिकित्सकों को जो इस मंच का एक उद्देश्य है, एम है कि हमारे जो पार्टिसिपेंट्स हैं, हमारे जो स्कॉलर्स हैं, हमारे स्टूडेंट्स हैं, वो नौकरी ढूंढने वाले ना हो, नौकरी देने वाले हो। नॉट अ जॉब सीकर बट जॉब प्रोवाइडर। बहुत बहुत धन्यवाद। इमरजेंसी
Thank you, ma'am.
स्पीकर की भूमिका में आने के बावजूद भी आपने बहुत अच्छा प्रेजेंटेशन दिया और बहुत सारे लोगों ने सराहना की है। डॉक्टर अंबिका सिंह, डॉक्टर चंद्रकला, डॉक्टर रजनीश जी, डॉक्टर अविनीश जी, आप वेस्ट इंडीज से हैं, और डॉक्टर उज्ज्वला, डॉक्टर नवीन, डॉक्टर नवीन कुमार, डॉक्टर सेलाइन, डॉक्टर समिता ने सबसे पहले आपकी सराहना की है। और मुझे लगता है कि ये बिल्कुल दूसरे पार्टिसिपेंट लिख नहीं पाए हैं, बाकी दिल तो उनका भी यही कह रहा है कि नहीं, बहुत अच्छी प्रेजेंटेशन है। और मैं समझती हूँ कि बहुत ही बढ़िया। डॉक्टर मिथिलेश जी भी कह रहे हैं कि बहुत बढ़िया प्रेजेंटेशन। और मैंने अभी अनम्यूट सभी को कर दिया है, आप अपना प्रश्न पूछ सकते हैं। डॉक्टर भुवनेश जी नमस्कार। डॉक्टर भुवनेश जी हमारे इमरजेंसी स्पीकर है। और जब भी मुझे कई बार ऐसे रहा कि कोई नहीं मिला, तो डॉक्टर भुवनेश और दीक्षा खतुरिया और साथ में डॉक्टर विकास, ये तीनों का है ना बहुत ज्यादा साथ रहा, जिसके बहुत अच्छा मैनेजमेंट हो जाता था फिर। स्वागत है डॉक्टर भुवनेश जी। हेलो डॉक्टर भुवनेश, आप अनम्यूट कर सकते हैं। शायद उनका हैंड रेस तो है, मगर वो। हाँ डॉक्टर फातिमा, बहुत बहुत धन्यवाद लेक्चर की सराहना करने के लिए। और डॉक्टर रश्मि जी मौर्य, बहुत बढ़िया, धन्यवाद आपका भी। एक्सेलेंट, वेरी इंफॉर्मेटिव सेशन सच में है। और मुझे लगता है कि बहुत अद्वितीय है कि आगे से पूरी थ्योरी को बहुत अच्छी तरह क्लियर करके फिर संप्राप्ति विघटन तक, और उसमें आम पाचन से लेके मैं सारे पार्टिसिपेंट्स, खासकर जो अभी नए नए चिकित्सा में आना चाहते हैं, मैं समझती हूँ कि इसको 2-3 बार सुनिए, उसके स्टेप्स बनाइए, उसको लिखिए, और जो माइन्यूटली ऑब्जर्व करके जो पोर्शन बोला गया है, उसको आप चिकित्सा के पोर्शन को बहुत अच्छी तरीके से आप फिर अपने पेशेंट्स के ऊपर अप्लाई कर सकते हैं, और डेफिनेटली रिजल्ट मिलेगा ही मिलेगा, है ना। रिजल्ट ऐसा नहीं हो सकता कि न मिले, कम मिले, है ना। और जिस व्यक्ति को इतने दर्द से हम मुक्ति दिलवाते हैं, तो वो कहीं ना कहीं बहुत अच्छी तरीके से आपका उस जो क्वालिटी है ना, उस गुण को वो याद रखता है। और माउथ टू माउथ मीडिया बहुत सारे लोगों को उससे पता भी चलता है। तो मैं समझती हूँ, एक पुराणों का उल्लेख भी है, मैंने पहले भी पेन मैनेजमेंट का जब ईयर रखा था, तब भी मैंने अपनी क्लास में बताया हुआ है कि हजारों अश्वमेध यज्ञ करने के समान पुण्य मिलता है अगर हम किसी को दर्द से मुक्ति दिलवाते हैं, है ना। क्योंकि दर्द, पेनफुल कंडीशंस बिल्कुल व्यक्ति को निढाल कर देती है, रोगी को, है ना, कि इतना असहनीय रहता है। और स्पाइनल वाले में तो बिल्कुल बहुत ज़्यादा रहता है। मैंने भी अपनी ज़िंदगी में जितने भी रोगियों को देखा, तो वहाँ उसकी ना करवा देते हैं। तो मैं समझती हूँ कि आज का लेक्चर सभी ही पार्टिसिपेंट्स को बहुत ही बढ़िया लगेगा। और इसका यूटिलाइजेशन भी आप जितनी मेहनत से डॉक्टर साहब ने बताया है, पीपीटी बनाई है और अपना क्लिनिकल एक्सपीरियंस इस मंच पर बहुत दिल की गहराइयों से उसको शेयर किया है। तो मैं समझती हूँ कि हम सभी को उसको उगाना चाहिए, आगे उसको बढ़ाना चाहिए। तो मुझे लगता है कि बहुत अच्छा लेक्चर है और डिटेल में बहुत अच्छे आंसर मिल गए हैं और कोई ऐसे हैंड रेस है नहीं। और डॉक्टर अभी आप 2 शब्द बोलना चाहेंगे और डॉक्टर साहब का धन्यवाद भी कर दीजिए, आप या फातिमा या दोनों ही। हेलो डॉक्टर अभी।
जी नमस्ते मैम.
जी जी जी, नमस्ते बेटा, नमस्ते।
Yes, ma'am. This session was good, and Dr. Shinsha, she's my PhD batchmate, and
ओके ओके।
all the treatments that she said, it is confirmed by me, ma'am. We had practice in department and everything, and patients are getting good relief. So
जी
thank you for having this session and sharing the knowledge with other doctors as well, so they can also bring relief to their patients. Thank you, ma'am, and thank you, Dr. Shinsha.
जी। डॉक्टर
Thank you,
फातिमा।
Dr. Ravi, sir.
हेलो।
Namaste, ma'am. Thank you so much for very informative session, and I hope there will be more. And thank you for your kind consideration for all the webinars that you are making.
थैंक यू।
Thank you, ma'am.
बहुत बहुत धन्यवाद। मुझे लगता है कि हाँ, डॉक्टर राजीव यादव, आप कुछ पूछना चाहते हैं या बताना चाहते हैं?
मैडम पूछना है।
जी जी जी, बताइए। हाँ जी, बताइए।
मैडम मेरे पास एक पेशेंट है जिसको ऑस्टियोआर्थराइटिस बता के डॉक्टर्स ने जो है फोर्टिस हॉस्पिटल के ने नी रिप्लेसमेंट बताया है, बट मेरे अकॉर्डिंग जो है वो स्लिप डिस्क का पेशेंट है, क्योंकि उसको लोअर बैक पेन और नर्व कंप्रेशन मेरे को एग्जामिन करने पे फील हुआ है, तो उसका क्या ट्रीटमेंट रहना चाहिए?
आपको ट्रीटमेंट लो बैक एक के लिए करना है, नी जॉइंट के लिए, दोनों के लिए करना है?
मैं दोनों के लिए ही करना है, क्योंकि पेशेंट का ऑस्टियोआर्थराइटिस तो है, मगर उसका पास्ट हिस्ट्री ये है कि वो विलेज में जो है काम करते थे खेतों में, तो इस वजह से उनको बैक की प्रॉब्लम भी है।
ओके ओके, एज थोड़ा बता सकते हैं,
60
एज एंड?
60 है मैम पेशेंट की एज।
68। ओके, 60 इयर्स में तो हम कंप्लीट रिलीफ तो नहीं चाहते, बट सिम्टोमेटिक रिलीफ के लिए नी जॉइंट के लिए बेस्ट थिंग, मेरे एक एक्सपीरियंस है, बना करने से उनका जो इवन ऑस्टियोफाइट्स भी रिसॉल्व होते हैं और काफी रिलीफ होते हैं पेशेंट को। बना स्वेट यू कैन ट्राई इफ
मैम सॉरी,
देयर
ये
इज
समझा नहीं मैं ये मैम।
उबना स्वेत, उबना स्वेत।
अच्छा, उपना स्वेद। ठीक ठीक है। और
ओके,
मैडम ये
इवन लो
लोअर
बैक
बैक
एक
में
के
जो,
लिए
हाँ जी,
डिस्कम्प्रेशन है तो जो ट्रीटमेंट्स हमने बताए बस्ती आप कर सकते हैं। लेप इफ देयर इज इन्फ्लेमेशन है, अगर आपको थोड़ा शोफर चिकित्सा देना है तो इनिशियली लेप कर लीजिए, उसके बाद आप कटी बस्ती में आ जाइए। देन पत्रपिंड श्वेता दोनों के लिए, घुटने के लिए भी अच्छा है और कमर के लिए भी अच्छा है, तो अधरांग मीन्स इंक्लूडिंग लोअर बैक यू कैन डू पत्रपिंड श्वेता। अदर कॉमोबिडिटीज वगैरह नहीं है, डायबिटीज प्रेशर वगैरह ठीक है
नहीं
तो
है मैम,
उनका
ये सब कुछ
कर
नहीं है।
सकते हैं, तो फिर आराम से आप स्वेदन प्रोसीजर्स भी कर सकते हैं। और लेटर आपको थोड़ा और बल्य चिकित्सा जैसे साष्टिक पिंड स्वेद हम करता है, तो इवन दोनों घुटने का भी ये सेम प्रिंसिपल है, जैसे हम थोड़ा मसल स्ट्रेंथ बढ़ाएंगे तो स्पेस थोड़ा सा प्रॉपर हम मेंटेन कर सकते हैं। इवन बैक मसल्स का भी स्ट्रेंथ बढ़ाना है, तो स्ट्रेंथ बढ़ाने के लिए आपका अभ्यंग स्वेदन, जो पीड़चिल है, शास्त्रीय पिंड स्वेद है, ये सारा चिकित्सा में आप कर सकते हैं। और इंटरनली आपको बल्य ब्रह्मण वगैरह देना है अकॉर्डिंग टू अग्नि, जैसे अश्वगंधा वगैरह जो अग्निमांद्य पेशेंट्स में ज्यादा नहीं देना चाहिए, अदरवाइज उसके साथ थोड़ा सा पंचकॉल मिक्स करके दे दीजिए, क्योंकि
ठीक
वो
है मैम।
प्रॉपर एक्शन कर पाएगा। बायो अवेलेबिलिटी भी अश्वगंधा के पंचकोल मिक्स करने से बढ़ जाती है कई बार।
ओके मैम, इसकी रेशियो कितनी रखनी है मैम?
किसके? पंचकोल के?
पंचकोल और अश्वगंधा का, हाँ जी।
हाँ, अश्वगंधा अगर 3 ग्राम ले ले तो पंचकोल 1 ग्राम से नीचे लेने में।
ठीक है
1
मैम।
ग्राम तक हम आराम से दे सकते हैं।
ठीक है
बहुत
ठीक है,
बहुत धन्यवाद।
थैंक यू मैम।
जी धन्यवाद जी। डॉक्टर उज्ज्वला ने चैट बॉक्स में भी एक क्वेश्चन डाला हुआ है और उन्होंने हैंड रेज भी किया है। डॉक्टर साहब आप ही अनम्यूट करके पूछ लीजिए।
नमस्ते मैम।
जी
बहुत अच्छा प्रेजेंटेशन था। इससे हम फिर से पढ़ेंगे और फिर से उसका स्टडी करेंगे। बहुत ही अच्छा। तो मैम मुझे एक केस डिस्कस करनी थी कि 44 इयर्स फीमेल है और उसका जैसे कि विश्वाची में जो लक्षण आते हैं ना, राइट साइड के पूरा हाथ में बहुत दर्द है और थोड़ा सा रिस्ट्रिक्टेड मूवमेंट है। बहुत ही शूल, मतलब रात दिन पूरा काम करने के बाद भी शूल है, नहीं काम किया तो भी शूल है। और उसका एमआरआई में डिस्क डेसिकेशन आया है C4 C5 और C5 C6 लेवल में, और थोड़ा सा प्रोट्रूजन भी है। तो इस डिस्क डेसिकेशन फिर मैम इनिशियली तो उसको कोट्टम चुकादी तेल से अभ्यंग किया था और योगराज गुग्गुल रासना एरंडादी दिया था 7 दिन के बाद। 7 दिन दिया और उसके बाद बस्ती तिक्तक क्षीर बस्ती में अश्वगंधा और धन्वंतर तेल और ये यूज किया था, तिक्तक गुग्गुल तिक्तक घृत, और अनुवासन में गुग्गुल तिक्त और धन्वंतर यूज किया था ऐसे। तो पेशेंट गृहिणी की भी है तो उसको थोड़ा सा बर्निंग स्टार्ट हो गया था पेशेंट को। तो अभी फिर मैम इसमें तो इतना कुछ रिलीफ नहीं आया, तो उसमें हम ग्रीवावस्थी कटिवस्ती भी किया था, जैसे कि मुरी वेण्णा और बलाश्वगंध लाक्षादी से ग्रीवावस्थी कटिवस्ती किया था। तो इसमें हम मतलब क्या गलती हुई और क्या आगे दे सकते हैं इस पेशेंट में?
आई थिंक
लास्ट लॉर्डोसिस भी है मैम।
डिजेनरेटिव कंडीशंस है। आपने जैसे बताया डिस्पेसिफिकेशन, इट इज इनिशियल स्टेज ऑफ दिस डिजेनरेशन, बट आपको उसका कारण एक बार देखना है। अगर अर्ली एजेस में है तो जैसे मैंने बोला है, ऐसे पेशेंट्स में आपको कई सारा विदग्धाजीर्ण के केस मिलेगा। तो विदग्धाजीर्ण आपको पता है वो एक आम के कोष है। आम अगर धातु में आम बन गया, फिर धातु में लीनावस्था में गया, फिर प्रॉपर नरिशमेंट नहीं होता है, धातु के प्रॉपर पोषण नहीं होता है, धातु ठीक से नहीं बन पा रहा है, तो ये ग्रेजुअली रेसरेक्ट जैसे जाएंगे तो अस्थि में भी ये प्रॉब्लम हो सकता है। तो ये विदग्धाजीर्ण मुझे लग रहा है पेशेंट को आपको ये चीज आप करना चाहिए अलॉन्ग विथ स्ट्रेस फैक्टर्स। ये दोनों आप रूल आउट कर लीजिए। वैसे आप गलती तो नहीं किया, पर इन केसेस में फर्स्ट अपनी को आप ठीक कर लीजिए। ऑलमोस्ट आपका बाकी जो आप ब्रह्मांड जो भी दे रहे हैं ना, वो सब डिजेनरेटिव सोच के हम क्षय कम करने के लिए जो भी ब्रह्मांड औषध देंगे तो वो ज्यादा इफेक्टिव होगा। तो इसलिए उस कंडीशन यस यस
या मैम क्यों इस केस में आपने जो बोला ना कि विदग्धाजीर्ण,
यस
तो ये केस में है ना, क्या है मैम, पेशेंट है ना सहज ग्रहणी की पेशेंट है। सहज
कौन से ग्रहणी की?
सहज मतलब जन्म से ही उसको ग्रहणी का प्रॉब्लम है।
दैट्स व्हाई आई टोल्ड दैट इज अग्नि विकृति इज देयर। अब ग्रहणी के देखें तो आपको बाद में क्या प्रॉब्लम होता है, ग्रहणी में सारा धातु के सारता कम होती है क्योंकि प्रॉपर एसिमिलेशन नहीं होता है। तो ऑब्वियसली देयर मे बी चांस फॉर अस्थि क्षय ऑल्सो। सो दैट्स व्हाई आई टोल्ड आपको अग्नि के ऊपर ज्यादा काम करना है, अदरवाइज ये प्रॉब्लम्स होते रहता है। एंड मे बी स्ट्रेस भी एक कारण हो सकता है पेशेंट में, तो उसको भी आपको थोड़ा सा मैनेज करना होगा। सर्वाइकल पेशेंट्स में आप 80% फीमेल्स में देखें तो स्ट्रेस इज द रीजन। तो वो कंटिन्यूअस पेन भी आप बोल रहे थे ना, कई बार जो जो डिस्प्रोट्रूशन की वजह से जो पेन होता है वो वर्क डिपेंडेंट होती है, एक्टिविटी डिपेंडेंट होती है, पर इस केस में वो भी नहीं दिख रहा। आप बोल रहे 24 आवर्स पेन है, तो रूल आउट करो स्ट्रेस का कितना इन्वॉल्वमेंट है, अकॉर्डिंगली उसका देख लीजिए। बाकी बेटर है आप इनिशियल स्टेज में तेल यूज मत करो, बाकी ओके है। ओके मैम, फिर अभी अवरोहण के लिए हम क्या दे सकते हैं, जैसे करेक्ट करने के बाद, अग्नि करने के बाद क्षीरबला आवर्ती कैप्सूल यूज कर सकते हैं?
क्षीरबला यूज कर सकते हैं, महाराजा प्रसारण्यादि तैलम यूज कर सकते हैं। पेशेंट इज हैविंग गुड एपेटाइट, डाइजेस्ट हो रहे तो प्रसारण्यादि तैल का आवर्ती कैप्सूल मिल जाएगा। और बहुत ज्यादा स्ट्रेसफुल वगैरह है तो क्षीरबला इज बेटर, वो स्ट्रेस भी कम करेगा, थोड़ी बहुत ब्रह्मांड भी करेगा। हेडेक वगैरह एसोसिएटेड है तो क्षीरबला ऑप्ट करो। अगर सिर्फ नेक में ही पेन है, मीन्स विश्वाजी का प्रेजेंटेशन है, प्रसारण्यादि तैला, महाराजा प्रसारण्यादि तैला इज गुड। एंड यू कैन ऑल्सो यूज गुगुलु तिक्तग्रह, बट पहले आप गृहिणी को ट्रीट करो षटपल वगैरह यूज करके, फिर इसी में आ जाओ।
ओके, थैंक्स मैम।
जी बहुत बहुत
वेलकम।
धन्यवाद जी। लास्ट में मैं शांति मंत्र लूंगी और आज के स्पीकर डॉक्टर शिंशा जी का बहुत बहुत तहे दिल से धन्यवाद इमरजेंसी स्पीकर बनने के लिए। और एक सामान्य धन्यवाद तो है ही है, विशेष वाला धन्यवाद भी है। और ऐसे ही मैं समझती हूँ कि एक लेक्चर इमरजेंसी वाला और तैयार करके रखिएगा, तो कभी बिजली गिरती है तो हम तुरंत ही आपको याद कर लेंगे, है ना। बहुत बहुत धन्यवाद।
Okay, ma'am. Sure. I would like to thank you also, ma'am, for giving me this opportunity. Thank you.
जी जी
Thank you all for patience hearing.
जी डॉक्टर दिव्या का भी बहुत बहुत धन्यवाद, आपसे मिलवा दिया तो उनका भी धन्यवाद बनता है, वरना हम मिल नहीं पाते और इतना अच्छा स्पीकर इतना नहीं हो पाता। सबसे लास्ट में मैं शांति मंत्र ले लूंगी, आप सभी म्यूट रखकर ही दोहराएंगे। ओम सर्वे भवन्तु सुखिनः, सर्वे सन्तु निरामया, सर्वे भद्राणि पश्यन्तु, मा कश्चित् दुःखभाग् भवेत्। ओम शांति शांति शांति। नमो नमः। विश्व मंगल की कामना के साथ सभी पार्टिसिपेंट्स का, बहुत सारे अच्छे अच्छे क्वेश्चन पूछने वाले सभी पार्टिसिपेंट्स तथा जिन्होंने अच्छी सी सराहना भी की इस लेक्चर की, उन सभी के लिए सभी का धन्यवाद। आज के स्पीकर का विशेष धन्यवाद। और अपने अपने जगह पर रहकर आप अपने हिस्सेदारी की प्रामाणिकता आयुर्वेद के प्रति बताते रहेंगे। बहुत बहुत धन्यवाद।